Your substandard community in ways the new age so much as now. Today I have the Honorable M.A. Dr. M.A. Mazibuko, and we are at the Cure Institute. We're here to discuss serious issues about our health. You know, when we are growing up, sometimes we ignore certain health issues. But I got a call from him, he was like, dude, we really need to start teaching people about health. So today we're going to discuss a serious topic about asthma. Doctor, can you please first introduce yourself and then tell us a bit about asthma for people who don't know what that is?
No, thanks for your kind words. I'm Dr. M.A. Mazibuko at the Cure Medical Institute here in Germiston in 219 Mayor Street. Asthma is a serious disease that is very prevalent all over the world. There is about 20% of the population that has asthma all over the world, and this prevalence of asthma is increasing since many decades ago. And it's a serious illness that needs to be discussed and known about, and also treated to prevent complication. We define asthma as an obstructive lung disease which primarily affects the airways. The airways are constricted, that's number one. And the second thing, there is hyper-responsiveness in these airways. And the third thing about asthma is that there is secretions or mucus in the lungs that builds up in the airways, so that people with asthma then have symptoms that are related with this airway obstruction, which is number one, wheezing, shortness of breath, tightness of chest, and also sudden death if not treated properly.
So how do you diagnose it? Like for someone who doesn't know those symptoms, do I go to the doctor or I can diagnose myself? How is it diagnosed?
Asthma is diagnosed by doctors. You can't diagnose yourself. As you can see these days, we've got many Google doctors and many street doctors who think they can solve medical related problems. You need to see a qualified medical doctor who's going to do tests. There are many tests that we do to diagnose asthma. First of all, we can diagnose asthma on clinical history and clinical examination. When you come and tell us the symptoms of asthma, we then also examine you with our stethoscope, which is here. For audience who don't know a stethoscope, we then, when we examine you, we will hear wheezing sounds, which is with the stethoscope, and many polyphonic sounds that we hear, and also the tightness of your chest. And when we look at your chest, it's hyper extended because of this chronic asthma. We will then also diagnose asthma with certain tools that we have, which is an X-ray. On X-ray, we will see signs of hyperinflation, or we will see other signs of chest that is elongated on the X-ray. And we also do tests of skin pre-test where we put an allergen, because most of the time is associated with allergic test. It's associated with allergen. There's a skin test that we do on your skin. We put an allergen on your epidermis, and there will be a well that will form on your skin, and that will be suggestive that you've got a certain allergen, because it's most of the time associated with allergies. So
that it is associated with allergies. I wanted to ask you more about that because it's intriguing. So, how many people do get allergies based on asthma, or how many people just have asthma without allergies?
A large portion of people, about a large majority of people have association with what we call the term atopy. Atopy is nothing but an allergy associated disease. It's mainly associated with IgE. hyperresponsiveness through the mast cells and these other complicated cascades of inflammation, which I don't want to delve much on for simplicity. So, majority of people with asthma would have a high preponderance of allergies, but a few majority also has asthma not related to the allergy. You find that this asthma was triggered either by cigarette or by chemicals at work, or by emotions, or just by yes, emotions can cause people to have asthma.
So, is it genetic, or I just get asthma because I'm born with it, or I get it from previous people like my grandmother? Is it genetic?
Asthma, there's an element of genetics involved in it. The primary genetics that are involved in the gene studies that it has been discovered is associated with on the chromosome 5. There is a mutation that happens with the interleukin 4 and 5 and 3 and other other factors like interleukin 19 and 17. It has an element of genetic factor, but mostly it's also associated with environmental factors, which we would like to also caution society to avoid these environmental factors such as cigarette, because there's a high incidence of cigarette smoking these days, which causes asthma. And too cold environment, we're approaching a cold season, you'll have a lot of asthma during this time because coldness it predisposes somebody to asthma, and also chemicals, because these days we've got a more industrialization than ever. Chemicals like the chemicals that we use for spray painting, floor painting, like your polyurethane, your chemicals that we use to clean the dry cleaner, it also can push people to asthma. Yes.
Okay, so how does it affect an individual? Like, what are the damages it causes for an individual, and how does it affect their day-to-day life?
It's a very good question. Asthma is a disease, if not treated, can lead even to death. That's how bad it is. But one of the interesting things that what asthma does to individuals is that, number one, it makes them not be able to work because now they've got dyspnea, which is being tired, and also unable to breathe. Some of the people, if not treated very well, asthma will have to live with oxygen, and some people need to be hospitalized, where in cases where they get an acute severe asthma, which is a emergency that needs to be treated carefully, so to prevent a person from going from an acute severe asthma to silent chest, which means there's no more air coming through the lungs or leaving the lungs. Because you would bear in mind, asthma is a disease that affects the lungs. So the primary function of the lungs is to allow oxygen to come in and carbon dioxide to leave the body, and also to play a role in what we call cellular respiration. It's where life